Have you ever heard of celiac disease? It's a chronic autoimmune disorder that directly affects the small intestine. But what triggers it? The culprit here is gluten, a protein found in wheat, barley, and rye. When a person with celiac disease consumes gluten, their immune system swings into action, but not in a good way. Instead, it attacks the lining of their small intestine, causing inflammation and damage. Now, I know what you're thinking. Sounds complex? Let's break it down. So, how does celiac disease make itself known? The tricky part is, symptoms can range from the obvious to the subtle. Individuals may grapple with abdominal discomfort, frequent bouts of diarrhea, unexplained weight loss, or constant fatigue. Nutritional deficiencies are also a common sign due to the damage done to the small intestine. Yet it's important to remember that some people with celiac disease may not experience any noticeable symptoms. But how do doctors confirm that it's celiac disease? Stay tuned to find out. Diagnosing celiac disease involves more than just considering symptoms. The process typically begins with blood tests that measure specific antibodies related to the disease. If these tests suggest celiac disease, the next step is often a biopsy of the small intestine. This procedure allows doctors to assess the extent of any damage caused by the disease. Now let's talk about treatment. The primary treatment for celiac disease is not a drug or surgery, but a lifestyle change, specifically a strict, lifelong gluten-free diet. This means avoiding all sources of gluten, including wheat, barley, rye, and their derivatives. By adhering to this diet, many individuals experience a significant improvement in symptoms and healing of the small intestine. It's worth mentioning that this is not a quick fix. It's a lifelong commitment, but one that can dramatically improve the quality of life for those with celiac disease. But what happens if celiac disease goes untreated? Untreated celiac disease can lead to various complications. When the small intestine is repeatedly damaged, it has a harder time absorbing essential nutrients. This can result in malnutrition, regardless of how much the individual eats. The lack of calcium and vitamin D absorption can lead to osteoporosis, a condition that weakens bones and makes them prone to fractures. Celiac disease can also interfere with the body's reproduction system, leading to infertility. Neurological problems including migraines, seizures, and nerve damage are another possible complication. And let's not forget the increased risk of other autoimmune disorders like type 1 diabetes and multiple sclerosis. Despite these potential complications, celiac disease is often undiagnosed due to its varied symptoms. It's estimated that about 1% of the global population has celiac disease, making it a common condition. It can develop at any age, and individuals with a family history of the condition are at a higher risk. It's crucial to distinguish celiac disease from gluten sensitivity. But what's the difference? Celiac disease and gluten sensitivity may seem similar, but they're not the same. Celiac disease is an autoimmune disorder where the body mistakenly attacks its own cells in the small intestine when gluten is consumed. Gluten sensitivity, on the other hand, does not trigger this autoimmune response. It may cause discomfort and similar symptoms, but the body doesn't wage war on itself. The key to managing both conditions lies in a gluten-free lifestyle. But it's not just about avoiding wheat, barley, and rye. It's also about being vigilant against cross-contamination. Even tiny amounts of gluten can trigger a reaction in those with celiac disease, making the simple act of sharing a toaster or using the same cutting board a potential risk. If you suspect you have celiac disease or gluten sensitivity, consult with a healthcare professional. It's not just about cutting out gluten, it's about managing your health in the long run.